kind of a related aspect of a scenario like that, and again, this is not an uncommon thing. So horse diagnosed with strangles. Now 2 other horses in the barn have big lymph nodes. So someone went with plan C over here, did the let's wait and see, and now, yep, that horse has strangles. Yep, now we've got a couple other guys that have strangles. Everyone thinks strangles bad. Some people intuitively think, okay, strangles must be a dirty barn, must be stupid people, must be something like that. So something's going on, and the rumor mill is in full swing, and everyone knows how the rumor mill works in the horse world. And there's paranoia, there's concern, there's stigma, there's finger pointing. It's just a bad situation altogether. So what happens? This, right? So everyone comes in. It's amazing. You diagnose strangles at 2 o'clock, and about 2:10, you got half the trailers in the county. You're pulling up, taking the horses, shipping them out somewhere else, right? And it's a logical fear response, right? My horse is in there. My horse looks good. This horse is sick. I don't want near that sick horse, so I want to get rid of it. But the problem with that is, well, there are a couple problems with that. One is my horse may already be exposed. And maybe taking it away is going to make it sicker, the whole stress thing. Maybe it's going to affect someone else. And if we do things right on the farm, then maybe it's not going to get exposed anyway. But what happens too much is they get shipped across the countryside, and then we go from the single case to the couple cases on the farm, to the couple cases down the road, and the couple cases down the road. And this happens. This is how we get some of these regional outbreaks of strangles. This is a disease that's circulating around all the time. It's containable on a farm if we do things right. And it's not necessarily that hard to do, but there's a couple issues we have to deal with. So was this preventable? Well, the horse went to the show and got strangles from a carrier that was healthy, and they did basic common sense things, and it got exposed. Well, that aspect wasn't preventable. Wasn't the horse owner's fault necessarily. If they went there and they did some stupid things, and the horse with the big discharging lymph nodes is on the front grounds too, and they went nose to nose, different story. But a lot of these are just inadvertent. So that as part of the normal activity using this horse and using some basic common sense practices, they still picked up strangles. It's going to happen. Came back to the farm. Okay, but if they chose plan C here and said, okay, something weird is going on, but let's just see what happens. That's when you start getting into, okay, that was probably preventable. So maybe those subsequent cases on the farm, maybe there was an issue there. But then if they start spreading it to the countryside, you're certainly getting into the preventable component there. If I know my horse is in a barn that's got strangles and I ship that horse somewhere else, I know I've got a reasonable chance of bringing strangles with me and exposing those other horses who then are going to ship out and then infect some other farm. And that's where we need to intervene. And there are a couple of things here. Communication is key. So in vet school, I didn't get taught a lot about communication, a lot of psychology and all the stuff that is infection control I really have to learn. There's a huge psychological aspect of infectious diseases because people think sometimes, and it's not everyone, but some people think, okay, if that horse got sick or that farm has an outbreak, that farm did something wrong. See, theirs not very good. My farm's fine because I'm smart. And they're just doing dirty things or whatever it is. Or this horse is sick here, so something bad's going to happen, so I have to get my horse out because I don't really know what's going on. But I know if I get my horse out of here, everything's going to be good. That's kind of the thought processes that go on sometimes. And for me, when it comes to communication with infectious diseases, there are a few adages that I think about. Lack of information is almost always worse than no information. Very rarely is the truth as bad as the rumor mill. So getting information out, telling people what's going on can be very, very important. Yes, we have a horse here that we think has strangles. We think it picked it up at this show. Here's what we're doing. Never announce a problem without a plan. Don't come in and say, hi, we've got a horse with strangles here. It's a highly infectious disease. It kills X% of horses that get it. Have a nice day, right? Because that's when they're going to go bring the trailers and head to the countryside. It's going, yeah, we have a horse here with strangles. It's a highly infectious disease. Can be fatal in a small percentage of situations. And here's what we're going to do. Never announce a problem without a plan, saying, okay, it's here. You may have been exposed, your horse may have been exposed, but here's what we can do to reduce the risk of transmission. Here's what we can do to contain it. Here's what we can do to make sure that this is going to be as low risk a situation as possible and much, much lower risk than you shipping it off somewhere else or you ignoring it. And if you're announcing what you're going to do, always say why. Because when it comes to infection control, what usually involves inconveniencing someone. If I tell you to wash your hands or to scrub your boots or change your coat or whatever it is, it takes a little bit of effort, time. If you just go up to someone and say, do this, they're not going to do it. Or they're less likely to do it. If you say, do this because this, and because makes sense, then you're going to have a much better chance of response. So if we're dealing with an infectious disease on a farm, so if you have a farm and you've got an infectious disease problem, think communication. Think about talking to people and think about how to get people to do what you want them to do. So how do we handle this situation? Again, we're back to this horses strangles, picked it up at the show, and if we isolate and cohort it, then we can control a lot of things. We take the horse, we put it by itself. We do that isolation, we do the hygiene, we do the disinfection, we do all the standard practices. We start thinking about who's been exposed and who's not been exposed, again, that cohorting concept. So here are the high-risk horses. Here are the ones that probably haven't been exposed. Let's get them off by themselves, because they're probably pretty clean. Let's keep them there. Let's try to prevent things from spiraling while we're sorting out what's going on. So it's kind of that initial buy time to figure out what's going on, obviously working with your vet on this. Typically with strangles, we're going to test to see who's infected. So ultimately, we're going to say, okay, here's the sick group, and here's the group that are exposed and maybe infected, and here's the clean group. That's really important. They're clean. We want to keep them clean, and then tell people what's going on, why you're doing, what if. Another concept that kind of relates to this is quarantine. This is an area that gets a lot of discussion. You hear about a farm that's got an outbreak with strangles, and someone's quarantined or a show won't let them go there, or X, Y, and Z are happening because they've got this infectious disease. So what actually happens with facility quarantine, or can it be done, is a common question. So who can quarantine a facility? And your vet can't quarantine your farm. You can't quarantine a farm. You can't quarantine your neighbor's farm. The feds can come in if it's a reportable disease. If you've got one of the list of reportable diseases, which there are very few equine diseases, it's not going to be one of these that we're going to deal with, they can quarantine us, the Canadian Food Inspection Agency, but if it's a horse, they're probably not going to get involved. In Ontario now, there's an act that's fairly recent where the provincial government can come in and enforce quarantine in a situation where they think it's an issue. So it doesn't have to be a public health issue or a reportable disease. They actually do have power to come in and enforce quarantine if it's a significant problem to the horse population, or animal population, or there's something that's bad and they think needs to be controlled. It's going to be very, very uncommon, but there is the possibility for quarantine, but it's rarely ever needed in a horse situation. Outside of a really rare reportable disease that we need to contain to figure out what's going on, facility quarantine, having the government come in and quarantine a strangles barn just doesn't make a lot of sense. And voluntary response is always better than forced quarantine anyway. Quarantine's a card someone could play over their head saying, okay, well, if you don't get your act together, then maybe the province will come in and inspect you. But in many, many different ways, it's better for us to be aggressive and do things right at the start, instead of having someone come in and dictate. And that's where, again, the communication, the risk assessment, making a plan, working with the vet to identify the outbreak and contain the outbreak is much more important than calling in someone that's going to try to tell you what to do. So how do we do that? Well, back to the scenario where we've got people that are trying to head for the hills with their horses. How do we deal with that? And again, a lot of that's communication. Like I said before, if you've got a person that's really worried about an exposure, or if you're really worried about exposure, what you want someone to come up to you and say, okay, yeah, we have strangles, and here's what we're doing. So at the end of that conversation, you're convinced that they're doing everything they can do, that if your horse isn't exposed now, it's not going to get exposed. If your horse is exposed now, well, it's happened. Shipping it somewhere else isn't going to help you. So that's kind of the big thing, is here's what we're going to do and why, and it's going to work, and let us have some time for that. Now, that's kind of the carrot approach. The stick approach is, well, if you know your horse has been exposed to strangles, and you take it to this farm down the road, and you bring strangles with you, what might happen there? Well, no one's really tested this in court, but I think if someone's on that farm, and you knowingly bring strangles onto the farm, it's different than going to the show and inadvertently bringing strangles back with you. If you know you've got a chance of bringing a bug to that farm, especially if you didn't tell them you're coming with a potentially strangles positive horse, I think you're setting yourself up to be sued for any medical bills for the horses, any shows they've lost, any loss of animals, loss of use. There's a big potential there, plus having half the province think you're an idiot if you've started this regional outbreak and it comes back. So it comes down to communication, it comes back to common sense and thinking about how we can control these things. Now, how do we control that a little bit more? And one thing that we don't do very well is thinking about infection control with boarding contracts, whether it's a racing stable or a show stable or a private boarding facility. There are certain things that we can do that can help with infection control. Because one of the problems we run into at times is veterinarians are bound by privacy regulations, where a vet can know this horse has strangles, but they can't tell anyone but that owner, right? And they know that certain things have to be done. They can tell the owner, okay, you need to do X, Y, and Z to prevent transmission of this disease. But you can't go to the other owner or the farm manager or another vet that might be dealing with these horses and say, this is what's going on, be on the lookout, here's some things you need to do because of medical privacy rules. But there are ways to get people communicating that. So think about boarding contracts. So boarding contracts have a lot of things in there about what you can do, what you can't do. But building infection control information such that, okay, if something is happening certain testing has to be done, reasonable testing. So if there's a strangles outbreak, maybe you can be bound to have your horse tested. Or you agreed not to take your horse off the property if the farm manager, in conjunction with the veterinarian, decide they need a short-term quarantine to sort out what's going on. Or little basic things like that. So if you have a public barn, and these are the houses you can run into with communication and with getting people to comply and all this, you can build that into a boarding contract. So that at least it's raised in advance, so people start thinking about it. Okay, well, something's going on here, and if they don't like it, then maybe you don't want them here. If they're going to say that, okay, I'm not going to let you tell me that I can't take my strangles exposed horse to the barn down the road. Well, then maybe you don't really want them on your barn, in your barn. So it's just something to think of. It's a really basic thing. How enforceable boarding contracts are, probably not very really legally, but again, it raises the issue, it gets them thinking about it, gives a little more pressure to do some of the things that we want to do, and as long as they're logical, well thought out, worked with a vet in advance so that they make sense from a control standpoint. Compliance. So one thing we try to do with facilities, with barns, is okay, come up with an infection control plan. And I've gone through a lot of this already. It's writing down some of these things that you're going to do. So it's, what do you do when a horse comes back from a show? What do you do when a horse is sick? What do you do for cleaning and disinfection? And if you get all these things written down, then it's easier to have people do it right, because you can refer to it, they can look it up. You don't have people doing different things. And it's easier to get compliance, because compliance is the biggest issue. And compliance is a huge issue in hospitals, be them veterinary hospitals or human hospitals. Healthcare workers know they're supposed to wash their hands after every patient contact, before every patient contact, and other things, and they don't always. And there are various reasons they don't. But the fact that they don't always is a big breakdown in infection control. Same thing on farms. People know they shouldn't take the sick horse to the show, but some of them do. People know they should quarantine, but some of them do, some of them don't. So how can we improve compliance? And part of that, I guess, is for me, is thinking about why they don't do what they're supposed to do. Some people, it's just inadvertent, you didn't think about it. So I didn't quarantine this horse after show because why would I? I hadn't really thought about it. I got this horse that had a fever. I decided to watch it for a couple days because it didn't look that sick. Why would I do anything different? And that's where, if that's the case, having information out there. So having a little manual that says, here's what we do for sick horses on this farm. If your horse has a fever, you must notify this person. The horse must go there. And this is the chain of actions that happen so that horse gets contained. So you can get away from that inadvertent non-compliance because people get informed, they get educated. There's the malicious, the non-malicious, or the just, I forgot, I didn't do it. So the more we can help people do it, the more we can facilitate it by making things easy to do. So if it's hand washing, maybe it's putting hand sanitizers up at the barn. So it's just something you walk by and you do, as opposed to having to really think about it and go search out a sink. There's the unavoidable, and that's kind of that non-preventable component. There's certain things that, yeah, we'd like to do it, we just can't. And it might be at the end of the day, we just can't. But before we should accept the fact that we say we can't do something, we should step back and really think about, is it something we can't do or something we just don't want to do or haven't tried to do? And then there are the people that just don't want to do it because they don't want to do it. And that's a big problem, and that's a lot harder to deal with. But thinking about why people aren't complying can be really useful and try to improve some of the practices that we do.